What if I told you the doctors who are supposed to save lives are now being told to save the entire system? This is Kenya News Update today. Coming up, you'll discover a radical new plan that's turning Nigerian physicians from protesters into architects and what it means for healthcare across Africa. But here's the twist. The leaders say the crisis is no longer about ideas. It's about something far more dangerous. Meet Professor Bala Adu, the president of the Nigerian Medical Association. For years, his group has been known for one thing: industrial action. But on Friday in Abuja, he unveiled a document that could change everything. The NMA's 2026 to 2030 strategic plan, a 5-year roadmap to transform doctors from a reactive pressure group into active policy leaders. He called it a statement of intent. But here's what nobody's talking about. The event's theme was from strategy to impact. And the keynote speaker, Permanent Secretary Abubakar Kana, dropped a bombshell. He said Nigeria's health crisis is no longer a problem of ideas. It's a crisis of leadership, accountability, and implementation. 9 years of advocacy, countless protests, zero transformation. That's the brutal diagnosis. And then something shocking happened. The panel session asked if doctors should remain just caregivers or become system architects, advocates, and nation builders. The answer was clear. They must play a broader role, but here's the part that will blow your mind. The strategic plan isn't just words, it's 24 specific objectives and 72 measurable outcomes, spread across 8 critical areas, from doctors' welfare and safety to innovative financing and clinical governance. The goal? To make the NMA the catalyst for health system transformation. But Kana issued a stark warning. He pointed to Nigeria's persistent doctor migration, the weak primary healthcare system, the low health insurance coverage. He said progress will come from measurable standards, enforcement, and sustained negotiation, not from more strikes. He argued the NMA must move from advocacy to accountability, and from strategy to real impact. Imagine training the best doctors in the world, only to watch them leave every year due to poor pay and unsafe hospitals. That's the reality. The plan aims to change that with structured pay frameworks, mentorship for young doctors, and mental health support. But if this plan is so detailed, why will it succeed where others failed? Professor Adu gave the real answer. No strategy succeeds at the document level. Its success will depend on ownership, alignment, and collective commitment. It reflects hard lessons from the past. This is the escalation, a medical association admitting that protest alone has failed. That the time for reactive pressure is over. The time for proactive leadership is now. The implications are massive. This isn't just a Nigerian story. It's a blueprint for health reform across the continent. Some say this is the accountability moment the sector desperately needs. Others warn that turning doctors into bureaucrats could backfire. But one question remains unanswered. If doctors become the system architects, who will be left to treat the patients in Ward 8C? The payoff is this. A group known for walking out of hospitals is now trying to rebuild them from the inside. Do you think doctors should lead health system reform, or should they stick to clinical care? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking news on Africa's biggest stories.